Good afternoon. We're here today to talk about VST Acupuncture. VST Acupuncture was created and developed by Dr. Jonghwa Lee. Dr. Jonghwa Lee has been an acupuncturist for 15 years. For the last 10 years, he has been working on the VST acupuncture technique which he developed. He owns 4 clinics in Korea as well as the clinic here in Irvine, California. I want to welcome Dr. Jonghwa Lee to our discussion of VST acupuncture. Dr. Lee, can you explain VST acupuncture and what is VST acupuncture?
Yeah, VST acupuncture includes the concept of the Tensegrities, and we are trying to restore human body's nature and ideal structure that is Tensegrities. That means we are using the reference point that is 4 reference point that is Vertex. So that is both shoulder joint and hip joint. We examine the patient 4 vertex as a reference in the 3-dimensionally, that is sagittal, colony, and transverse plane, and we check the ROM of the patient, and we found out where is the problem is, and we try to treat that, and then recheck the range of motion instantly.
Okay, so just to explain the Vertex synchronizing technique. The Vertex, we measure the shoulder and then the lower back and the hips, and we do range of motion measurements on these areas, and then you'll find restriction in certain muscles that you've identified, and then can you explain if there's a restriction in a muscle, how do you make it better? How do you increase range of motion?
Okay, for example, let's do that with the right shoulder joint. We check the patient lie on his back, and then check his external rotation and internal rotation like that. And we found out, compare both sides together and compare with the normal range of motion. And if we find there's some extreme limitation in the internal rotations, we focus on the antagonist for the internal rotation, that is the external rotators. For example, teres minors and infraspinatus. And we found out and palpate where there is a knot or the tightness, and treat with a needle and release the tightness and recheck the internal rotation. We found out you can find that the increase of the range of motions.
Okay, so as I understand it, you do a range of motion test. In the case of internally rotation of the shoulder, if there's a restriction, you've identified the teres minor and the infraspinatus muscle as being an antagonist muscle. That muscle is prohibiting the full internal rotation.
Yes, right.
So you've identified it, you identify those muscles, you needle into them. What happens after you needle? Do they get more range of motion?
Yeah, of course. If you find the exact point, the patient can tell the increasing of the range of motions before they were restricted.
These sound pretty amazing. What are the benefits that the patient can expect? Do they get increased pain, decreased pain, or better range of motion? And how soon? In your experience, say somebody has a neck pain, do they get instant benefits, or does it take a long time to get better?
The uniqueness of the VST is we can find the result instantly. The patient and the practitioner, both can find the better range of motions and better functions. It is not only the range of motions. The increasing of the range of motion means their function was restored together.
Can you describe the types of treatments? What type of problem can VST fix? If somebody has foot pain or hand pain, TMJ, neck or shoulder, what kind of treatments does VST help? What kind of conditions?
For example, usually we apply this to the diverse musculoskeletal disease. And even more, we apply nowadays the blood pressures. For example, the patient who has high blood pressure, that means they have the increased peripheral resistance. With the VST, we restore the ideal tensegrity of the human body. That means decrease of the peripheral resistance. So the patient's heart don't need to increase the output pressures. So yeah, that is how the VST can help the high blood pressure patient also. Yeah. Of course, yeah, it can be applied every kind of wrist pain, frequent ankle sprain, or low back pain, and herniation of the disc, low back or neck area. Yeah,
I think
whatever.
in the regards to tensegrity, which is so important to VST, tensegrity, you look at the whole body structure.
That's right.
And if somebody has a history of ankle pain, the tensegrity gets off, and it can eventually work itself up to the neck, and then even TMJ type problems. Is that the idea of tensegrity? That
Yeah, we deal with the ankle sprain and TMJ problem. Yeah, we deal with those kind of disease with the view of the VST. That means the patient, yeah, who repeated the ankle sprain. That means he has more tendency of the collapse of the tensegrities. So that's why he suffers from the frequent occurrence of the ankle sprains.
so a collapse of tensegrity. You look at the whole body from the ankle to the head, and you can measure the tensegrity. And
yeah, whatever
and
the
restore
patient
them.
brings, yeah, we have to check whole body. Yeah, we try to restore the trunk's frame. That is consists of the 4 vertex. Yeah, they are very good point as a reference.
Okay. Shall we do a demonstration video where we can show the audience what we do in the VST treatment room, in the examination room? Shall we?
Yeah, of course, why not?
Okay.
Oh.